thank my guest panelists for joining me. Barry, I'd like Barry just to introduce himself, if you wouldn't mind, Barry.
Hi, good morning or good afternoon. My name is Barry Volin. I'm the CEO and co-founder of the Managed Care Resource Alliance. Inspire Innovations is a member of our plan. I've spent 40 years in the managed care space, both on the plan and the consulting side, and I'm very happy to be here today.
Thanks, Barry. Cortney, could you just do a quick intro?
Sure. Good afternoon, everybody. I'm Cortney Reston. I'm the Assistant Vice President of Grievance and Appeals at Emblem Health. Been doing this for 20 years, so there's not an appeal or a complaint situation I have not come across. So happy to be here.
All right, great. So all of you probably, saw the agenda, right? So is my clicker not working?
You're probably too far away from your laptop.
Jeez.
If you just bring the laptop over here, Cor.
I think we're fine, right? As long as I don't start like that. All right, now we got it. Okay.
There you go. Now look.
Okay. All right, so hopefully you read the agenda in your book. So I am going to just very briefly, and for the sake of time, quickly recap some of the aspects of the STARS program that I think put this in context, put the conversation in context. And then I'm going to ask my panelists some questions. And really what this is all about is how does complaints, appeals, and grievances both directly impact STAR ratings, and how can it indirectly improve STAR ratings through utilizing the data that you can get from your appeals and grievances. So I know probably everyone in this room knows CMS created the STARS rating program, and this allows consumers to compare plans, right? And it's also a benefit to plans in that they have the ability then to use this as a marketing tool and bragging rights. And that helps you attract more providers and more members. And funny story about that billboard, I will just tell you, having worked in this industry and you hear about STARS and you're working with it for a long time, I was on a road trip with my husband in an RV, and there was this great big billboard, and the dork that I am took a photograph of it because I just thought it was the first time I had seen this kind of advertising. So I thought it was kind of a neat thing. So I took a photograph of it. So in addition to, of course, that, plans have the bonus payment. So if you're getting a 4, 4.5, or 5 star, not only do you get your base rate, but you get a bonus payment. You have the ability then to invest in additional supplemental benefits that makes your plans more attractive to members. And then you can, of course, enroll and market all year long. So those are why plans want to achieve a 5-star. And I know throughout this conference, we talked a little bit about there's a shift that's occurring where historically, a lot of the measures were more oriented around HEDIS and HOS and clinical measures. And now, of course, that is shifting. That weight is changing. So if you look at the pie chart, the parts in green now are really more heavily weighted towards the administrative measures and the CAPS, which are your consumer survey measures. The other thing that I think is interesting about this is that when you look at the data, historically, plans have done very well in the administrative area. They get 4 and 5 stars, so they've done well. But I think the challenge is going to be now with the cut points getting higher, CMS has raised the bar. When I look at some of the plans' data, they're actually outperforming in some of these areas, but they're getting a 3.5 star now with the new way in which CMS has changed the measures. So I think that we don't want to take for granted that we're just going to continue to do well here, right? So that's the first point I wanted to make. The second one is when you look at the CAP scores and you look at the averages of most plans, they're somewhere in and around a 3.2 score. And if you're trying to achieve a 5-star rating, you're not going to be able to do that unless at a minimum you have a 4 in this area, right? So these are the things that are going to be challenges for plans as we go forward into 2023 and 2024. So with that said, this is my last really point on stars. For me, I'm a very detailed person. I like to really understand exactly what we're talking about. And if you don't live in the specs, of the CMS stars rating, you may not know when people are talking about member experience or CAPS or administrative measures, what they're really talking about. And these are what they are. So what I want to do was touch upon the two aspects of this. Again, those measures that are directly related to complaints, appeals, and grievances. So we'll start with that. So Cortney, who, as she said, has been doing complaints, appeals, and grievances for 20 years. Emblem Health, she didn't mention it. They're probably have about 3.4 million members. So they're a fairly large plan. They do process a lot of appeals and complaints. And so these are three things that are directly in her, in her area. And I asked if she could maybe first, Cortney, maybe you could tell us a little bit about when you're reviewing decisions, right? You don't want the outside entities to overturn your decisions. So what types of things could plans do to minimize that and optimize what they're doing here?
Yeah, so we currently sit in this measure at 5 stars, and we get there we have a 3-prong approach. So first thing, and this was actually recognized by CMS as a best practice, is any case that's going to be upheld and submitted to MFSI gets reviewed twice. So it gets reviewed by the first either administrative person making that decision or the medical director. And if their decision is to uphold that, it goes to what we call our secondary review process. And that is an independent internal member of our team, whether a second medical director or a second administrative person on the G&A side. And they look at that and make sure, yep, that decision is sound. Yep, all our documentation supports that decision. And most importantly, they look at the type of service that's going to be upheld against the IRE database, we'll call it. On their website, they are nice enough to post summaries of their decisions. So you can look up, I have a MRI of the brain that I'm going to uphold. So we use their website. So that secondary reviewer is making sure that decision is sound, making sure it's supported, and looking for like similar decisions out on the CMS or MFSI website to look at that data to see how it compares to another decision. The third piece of that is when we get that decision back, luckily we don't have too many of them, but when we do get an overturn, we have a debrief on that overturn and we look at, is there a process improvement we need to make, an update to our clinical or administrative policy we need to make as a result of that decision, and is there any retraining we need to do for the team? So 3-prong approach, review it by a second person, make sure our decision is sound, check it against the MFSI database to see if there's other similar decisions, and then debrief on any overturns that we receive.
Awesome, thank you. That's really great. Great advice. So the next one, I'm gonna toss a couple of these at you, Cortney, and then we'll toss some you at Barry. So the next one is having the plan make timely decisions, right? And I think that there's various, tools and methods, and we all know that you also are dependent upon many people in your organization to be timely and external organizations, right? So it's very tricky to stay on time. So maybe you could talk a little bit about that.
Yeah, I mean, anybody who does G&A knows you interact with literally anybody in your organization. You're constantly reaching out to claims, your provider network management team, your enrollment team. And anybody who does that through email knows the pains of, I sent an email, I'm out of the office today. So they respond and nobody knows it. So we use our G&A tool, Compliant A&G, to task, what we call tasking to other departments. And that's right through the system, so anybody can access it. I get hit by a bus tomorrow, I call out sick. Everybody else knows what's going on with that case. And the important piece is there are SLAs baked right into there. So we have agreed upon SLAs of 5 calendar days to adjust a claim, 3 calendar days for enrollment. Those are baked right in there. So the department that's receiving that task knows when it's due. They know what it's about. And most importantly, if they think they cannot respond to us in that time frame, they can say, hey, we need an extension. And I can say, all right, you can have 2 more days because we still have 10 days to resolve this, or nope, denied. You've got to get it back to us today because we got to respond or we're going to be out of time frames.
Great. And then I think the third piece of this is complaints per 1,000 members. And of course, I think we'd all ideally like to reduce our complaints per 1,000 members. That would be the ultimate goal. But we also, plans get their data from CMS, and you want to make sure both the IRE data and the CTM data is valid, right? And I know, Cortney, in your experience, that hasn't always been the case, right? So again, maybe you just want to touch upon that problem and what you can do about it.
Yeah, so we have a process every week, every Monday. We pull the MFSI data and the CTM data off of the respective websites, and we validate it against our own data, and we submit those in real time. So as many of you are familiar, at one point during the year, you get the opportunity to validate your data, your STARS data during the preview. We're doing that in real time throughout the year. So every Monday we pull that data down, we validate it. This is an overturn. Yep, this is an overturn. This is timely. Yep, this is timely. For anything that they listed as untimely, we validate that we truly believe that's an untimely case. And there's a lot of opportunity there. We found many instances where we took an extension, but they had indicated, no, we didn't take an extension. So they had documented it as untimely. The other big one we see is they'll use our original receipt date. And as you guys know, our time frame restarts when we receive that waiver, that AOR, that good cause. And a lot of times we'll find that MFSI is documenting the original receipt date of that appeal and not the receipt of the information that kind of triggers that start point. So on a weekly basis, we pull that down. Any discrepancies, we reach out to them. So we're doing it in real time, and it decreases the burden at the end of the year.
Great, really good advice. So again, just to kind of recap this, so these are your, part of your administrative measures. And as I said, the cut points are going to get a lot harder. So really optimizing in this area is going to be, I think, important for organizations to continue to see those 4- and 5-star ratings that they were able to get in 2022. So I want to kind of shift the conversation a little bit to how you can then leverage the data that you get from your appeals and grievances in a more strategic way. And I've had this conversation with Barry and Cortney, and they have kind of slightly different perspectives, but I want to start with Barry. As a former CEO, he definitely thinks very big picture, enterprise-wide, and we talked through this. And so, Barry, maybe you can talk a little bit about this whole concept of, understanding top-ranking contributors and then the types of action plans, a plan could put in place. So if you could maybe talk through this a little bit, that would be awesome.
Sure, thank you. First of all, when we look at customer clients experience, we're looking at the entire experience. It's not just a series of unrelated transactions. So it starts from the point in time where we onboard a member. What are the expectations that we establish for that member? How do we confirm that with the member? How do we make sure that the communications we're sending out to the member are actually received and understood? Similarly, we have to do the same thing with providers. There are expectations that we have to establish with the providers. We have to provide them with ongoing education. And we have to look at the provider as an ongoing relationship that needs to be managed, not just a subcontracted vendor. At the end of the day, the most important transaction occurs in the provider's office between the provider and the member. And oftentimes, many of those levels of dissatisfaction occur right there. Those are the things that we need to be very, very careful of. We need to look at claims. We need to understand how our contracts are established with the provider and ensure that what we've established in a contract relationship with the provider is actually represented in our claims configuration. We don't want providers to be underpaid. We don't want providers to be overpaid. We want them to be paid exactly what they're entitled to, not a penny more, not a penny less. And if they are being denied, we need to be able to provide information to them as to how they can run a more successful practice. So we're not just looking at a series of independent transactions across this enterprise. We're looking at an entire sea change in how the organization treats ultimately its two clients, its member and its providers.
Yeah, so I'm going to just reiterate this too, Barry, because again, I think, we've had a lot of conversations and, so
Yep.
As we understand those top ranking contributors, and you and I kind of broke it down and we looked at all the different ways that we could look at complaint data, right? To whether it's on the provider and payment side, it's on the member side, and then kind of structuring this action plan, right, around these three areas. So that's what I thought was so great about this, which was how do you then take this information and say, well, how do we apply it to member actions? provider actions, and operations. And obviously that does require some level of oversight across the organization, and somebody kind of needs to help own and drive that, right?
Yeah, yes. The other thing to bear in mind is, as we intake complaints, appeals, and grievances, we need to ensure some level of continuity and consistency in how they're being categorized. And we need to be able to ensure that each of our agents that are taking those calls and taking those complaints and setting up actions around them are doing it in a consistent fashion, so that any sort of trend analysis we do and any actions that follow that are based on actual calls that have come in.
Yeah, that actually, I'm glad you said that, because it lends itself perfectly to this slide. You just happened to say that, which is spot on. We didn't prompt him to say that. So these couple of screens, any good vendor, I have to plug our own capabilities. And so we have a complaints platform, and one of the modules of it is an analytics tool. And if you look at this chart, really, we're directly correlating the CAHPS survey categories with the grievances being captured in the system, so that then we can not only capture that data, but we can then do root cause analysis, right? So it's not enough to know you have a customer service problem, but what customer service problem, right? Where is it coming from? Is it hold times? Is it the website? Is it people aren't returning your calls? So what, to Barry's point, is if you're not capturing data consistently about your complaints, it's going to be really hard to do decent analytics, right? So at this point, I also wanted to ask Cortney, so in your organization, right, you utilize these tools. What data do you look at? How do you share it with the organization? You know, how do you measure improvement? You know, just maybe you could talk a little bit about your experience there.
Yeah, and I'll plug your product because I love it. And this is a view of my system, I believe, my data. And we do use this on a monthly basis. So every single month we have what we call our G&A committee, and it is cross-functional. It has an attendee from literally every area of the organization. And we provide this feedback to them and develop, you know, discussions around it, obviously, and then action plans, and everybody has actions to take that come out of that. That's reported up to senior leadership. Everybody truly understands that, you know, we're not widget processors. We are not processing a claim to issue a check. There's a member behind each one of these. And to drill down into these categories really gives people a good, I'm big on pictorials. I think people react better to them. You can see it, you can feel it. So to be able to give these visuals to folks and really drive home what is driving this member dissatisfaction really helps you develop action plans to address them. Because to your point, Danielle and Barry, you know, I can say, got a lot of complaints about customer service. What are people going to say? Well, what are the complaints about? And if I can't tell them, well, it's because we gave them incorrect information, or 34 people were upset that they had long hold times. It doesn't get you anywhere. So you got to be able to drill down to that next level. And Barry, I was laughing when you said that, because when you're trying to drill down on this type of data, you have two problems. It's either the analyst, my specialist that's classifying this, is going to go to what they're familiar with, or they're going to use the first one they see. So in addition to drilling down on these categories, you want to make sure they're usable. They make sense, they're ordered correctly, people can find them, because your data is only as good as the person that's categorizing it and entering it. So that was such an important point. And you can see here, we do try to organize them in a way. So like, well, our customer service issues start with CS. So if you know you have a customer service issue, I got to go to this part of the drop down, because it's really important to make sure they understand what they mean and how to use them.
Awesome.
You know, if I could just add something to that too, the other challenge here is that every time we get an appeal, a grievance, and a complaint, we have to deal with it at two different levels. We have to deal with it at the individual transactional level and resolve the issue for the complainant. But equally as important, we need to aggregate that data and come up with trend analysis around those, how many we're seeing of that type, and then develop a system approach to how we can resolve that issue moving forward, with the intent of, if we've improved the system and addressed this problem at the trend level, the theory is that the number of complaints similar to this should go away because we've addressed the root cause.
Yeah.
And the last point I'll make is that this is not a one and done process. This is, you deal with the individual complaint, resolve the complaint at the individual level. But once you start dealing with the trend and improving process, you want to continually evaluate the effectiveness of the implementation of the solutions you've implemented.
And I think, again, I'm going to tie this back to stars and caps and all of those things, right? I mean, the goal here is, while this is, you're getting this data in your complaint system, the goal is to put in these initiatives to address these root cause problems that will then hopefully prevent future poor CAP scores, right? I mean, it's after the fact, but the whole point is to then try to be proactive, put in initiatives, and then monitor and measure those with trends, right? Barry, to your point, we want to see the trending, not only historically how we got here, but once we put an initiative in place and we solve the problem, what does that trending look like? Did it work? Was it effective? Right?
That's exactly right.
Perfect. So I'm going to just kind of sum it up. I think we're a little early, but I'm going to first open up to, does anyone have any questions for myself or for Cortney or for Barry? Go ahead.
So on the appeals, they often are, when the examiner looks at them, they code them, whether it's a level 1, level 2, level 3. You capture those different levels in your data.
We do, yes. Anyone else? Any questions? No, I know we are between you and lunch, so we don't have any other questions. So I'm just going to recap what we talked a little bit about, right? So first, no one's saying that clinical measures are no longer important, but when you looked at that pie chart, you can see that the weighting is shifting. So you're going to have to keep being really good at that, but you have to start to think about as a plan how you're going to optimize your administrative measures and your appeals. As well as try to utilize that data to improve member experience and the enterprise initiatives around that. 2, optimize your CAG operations. As I said, the cut points are going to get harder, and I do see plans outperforming in the past years, but the 22 data matched against these measures are going to make it very hard. And then, of course, try to utilize your CAG data or our data for our system to help identify where the problems are and improve member and provider experience. So appreciate your time. And I really want to thank my panelists. Thank you guys so much for joining us. I really appreciate it. Thank you.
Pleasure. Thanks.